So hepatitis B virus, just a little bit of background. This is a virus that affects the liver and it can persist as chronic infection and can progress to severe liver disease and can cause liver cancer. It is one of the most prevalent cancers, and it's the third leading cause of death globally, cancer causing death globally. About 250 million people in the world are infected with hepatitis B, and the highest burden is found in Asia and Africa. In the US right now, we have about 640,000 adults living with hepatitis B. And again, many of those adults were born in Asia or Africa. Next slide, please. So there's a handful of ways that we can prevent mother to child transmission of HBV. The first way that we do that is by identifying HBsAg positive pregnant women through routine pregnancy testing or testing at the time of delivery. Ideally, this is done during pregnancy because women who have high HBV DNA levels can also receive antiviral therapy during pregnancy to try to reduce the risk of mom transmitting the virus to her newborn. And then for all of those newborns that are born to HBsAg positive pregnant mothers, they should receive post-exposure prophylaxis as soon as possible after at the time of birth, after birth, and that includes HBIG or the hepatitis B immune globulin and a dose of hepatitis B vaccine. And those interventions can prevent about 94% of infections. And then all infants should receive a complete hepatitis B vaccine series. So not just babies born to positive moms, but all babies. And then the other really important thing that we're talking about today is the universal birth dose of hepatitis B vaccine, which is recommended for all newborns within 24 hours of birth. The sooner the better. And that serves as a safety net for any infants that were missed, that are born to positive moms or have household contacts that are positive. And the next slide, please. So again, why is the universal birth dose so important in the United States and globally? There was a 2023 study that found that up to 500,000 pregnant women who gave birth each year in the US were not tested for their HBsAg status. So that's a very big risk. The perinatal hepatitis B prevention program at CDC only identifies about half of the expected births to HBsAg positive women each year for case management. And to sort of quantify those numbers, over the last 15 years, CDC estimated there were between 24 to 26,000 expected births each year, but only between 11 and 12,000 were identified for case management. We also know that a birth dose of hepatitis B vaccine alone is 75% effective at preventing mom to baby transmission. And also there can be household transmission of HBV since it is highly infectious. So the birth dose can protect babies who have HBV infected household contacts, as well as babies that are born to positive moms that maybe we didn't know her status at the time of delivery. And the next slide, please. And this is the current date of hepatitis B birth dose coverage in the United States. From 2011 to 2021, you can see we peaked in 2019 at 77%, and then the most recent year of data is from 2021 at 76%. So still some work to do there. We would love to meet that WHO 2030 target of 90%.